Hello, everyone. Welcome to the presentation of Communication is a Two-Way Street, Preschool and Autism. This is given in collaboration between the University of Louisville's Kentucky Autism Training Center and the Berea Regional Training Center. My name is Enid Hurtado, and I will be the presenter for today. This is a re-recording of the session. The live session, Sonia Michael also presented, as well as there was interaction with a live audience of participants. Due to technical difficulties, though, I had to re-record this session, and so this will be a little bit more concise than our initial session. At the end, we will share our emails, or I will share the emails with you for you to reach out and ask us any questions that you may have. All right, let's get started. Before we start talking about content, we have some housekeeping items to cover. The first one is we invite you to access the participants folder on our Google Drive. You can either use the QR code that you see here or copy the bit.ly into your web browser. If you need to pause at this point, please feel free to do so. This is an important part of the presentation because, as you will see in the participant folder, there are a few resources that I will be referring to during this presentation. One of the most important pieces to me for you to have is the PDF of the PowerPoint. As you will see during this presentation, there are live links throughout the session within the PowerPoint. And so when you have the PDF, you'll be able to have access to all those links and all those resources right away. Also, it's a way for you to share the information with others, talk about it, print it out and post it as reminders, so you can use the information from today in any way that will help you out the most. All right. For those of you who have not attended any of the other sessions that we have presented this past year, the collaboration between KATC and Berea RTC was motivated by the fact that we are state agencies that support different populations, in the sense that Berea RTC, or Regional Training Center, is specifically for early childhood in the region where all of you are at in Kentucky. And the Kentucky Autism Training Center is specific to autism, but covers the whole state of Kentucky and covers the gamut from 0 to adult. So you can see in a sense, our focuses may be a little bit different, but where we overlap is with autism. And so Kentucky Autism does support students with autism in preschool. And not only that, we also support the families. We help support the families accessing resources within the community. We work with community members to improve the resources or to answer questions. So the reason why we bring this topic up is just to remind you that if you have parents who are looking for resources about autism, or you yourself or other professionals are, please access our website, and you may be able to find it right away, or we'll have ways for you to reach out to different members of our team that may help you find the information that you're looking for. On the other hand, if you're watching this session, then you may have already accessed the Berea website. But if you're looking for any information or need some support within your schools, either, again, just the same thing, access the website. Maybe you might find the information you're looking for, or reach out to the members of the team, and they'll be more than happy to help you. All right, one of the, I would say, foundations for the school part of KATC is really leaning on the evidence-based practices that are published by the, as you can see, NCAEP, or National Clearinghouse on Autism Evidence in Practice. This is one of our main goals, is to support school staff in not only learning about these evidence-based practices, but learning how to implement them with fidelity with their students. And it doesn't stop there. These are learning strategies that have been found to be the most effective for students with autism. And I would even say, as you look at this list, this small list right here, it's best practices in general. Now, this list, if you haven't seen this before, is not the whole list. There are 28 evidence-based practices. This is the list of the evidence-based practices that you will hear about today. And because all of them are robust, as far as having a definition and implementation steps and fidelity checks and data collection, all that good stuff that we have with all our evidence-based practices. I invite you that if you're not familiar with any of these, or if you would like to learn more about them, please access the modules at NCAEP's associated website called Affirm. And you will find free learning modules that will not only teach you about them, but they have a lot of great resources associated with them. So, a lot of them are about an hour to an hour and a half long. You may not need to watch the whole thing if you're already familiar, but the resources may be what you're looking for to share with other people or to really fine tune your own practice, and you'll have access to those right away. So I invite you to take a look at these modules after the training, and then on some of the slides you're going to see, especially for those evidence-based practices such as the first one, functional communication training, it's a very robust strategy, and so I invite you to take a look at the information around it, and you'll see a link on those slides too. Okay. All right, the first thing we're going to cover is autism and communication. So because this is a collaboration between KATC and the Brea RTC, we are looking at the big umbrella of communication through an autism lens. So to make sure that we're all on the same page with the basics about the diagnosis of autism, we're going to just cover some information that some of you may or may have already seen before or have learned before. So please be patient just to make sure that we're all on the same page. Now there is, this is information from the DSM-5, which is the official book of the psychiatry world, which autism is a psychiatric diagnosis. And although there are other diagnostic criteria, today we're going to be focusing on the fact that one of the diagnostic criteria for someone who's diagnosed with autism is their deficits in social communication and social interaction. And so if we look at that, and I want you to keep in mind that when it comes to the diagnostic criteria in the DSM-5, everything is at a deficit, meaning the person has challenges or doesn't have any evidence of, and that is one of the reasons they're eligible for the diagnosis. It's not looking at the strengths of somebody who may be diagnosed with this condition, okay? So we're not saying that this is how you should talk about autism, but we do know that the diagnosis of autism, the official diagnosis of autism, is useful and for students to be able to qualify for the services that they need, whether that be in the community as far as outside services that can go, that they can attend or go to the home, or if they're diagnosed in school, then the services that can qualify at school. So I just want to make sure that when I'm talking about this, communication-wise, I don't want you to just focus on the deficits, but it's important to understand this so we know how to support students with autism and anybody else who may have these deficits as well. Now, as I've given you a couple minutes or some time to read this page if you haven't read it before, but the key thing is as you can see, it's underlined. It says all of the following must be have either are currently being experienced by the child or by history. So if if this is a student who may not have one of these as strong or as obvious, I should say not strong, but as obvious as they did before because they've had early intervention services at home, but they qualified for those early intervention services because of their history with it, then this is also part of the diagnosis. Okay, so the deficits in social emotional reciprocity. Okay, so as you can see below, that's that normal back and forth conversation and knowing to, to initiate a conversation, or at least a back and forth communication by even just approaching a person and looking at them or making some type of action to get their attention. Not having a lot of shared interests, emotions, or affect, and the failure to initiate or respond to social interactions in a social environment. Deficits in nonverbal communicative behaviors used for social interactions. So a student may have some speech, right? But it's not what they would call functional speech. It's not really to communicate their needs, wants, feelings, opinions, ideas. So that's why they say poorly integrated verbal and nonverbal communication. Abnormalities in eye contact and body language, or deficits in understanding and use of gestures. So they may have these things, but they're not using it in a way to interact with others and communicate, again, their needs, their wants, sharing ideas, expressions, playing, any of those social things. One thing to keep in mind is that individuals with autism say that eye contact is maybe distracting for them. So it's not just eye contact for that. Okay. Deficits in developing, maintaining, and understanding relationships. So that's challenging as well. Just understanding the back and forth and what you do when you want to be a good friend, and how to maintain relationships. It says sharing and imaginative play, making friends, absence of interest in peers. So again, this is not to say that they're not interested in making friends. They just do not have the knowledge of how to be able to maintain those relationships or even initiate one. If you want to learn more about what this all means, please look at the website, the BRIA website, and there is an Autism 101 session I believe that we gave in the summer. And if not, if you don't find it, please reach out to us and we can get you access to it. All right, so again, this part of the presentation is something that I could talk hours about, okay, as you saw on the last slide. So I'm going over this very quickly just to give you some foundational knowledge for the next part. That will be more practical and helpful for you to understand how to implement some of these strategies in your educational environment. And so if you'd like to learn more about any of this, please reach out to us and we'll send you the training. Or if we don't have a training yet, then we will definitely make an effort to present one, in the future. All right. So something else that we have learned is that behavior is communication. Okay. So if you noticed in that last slide, a lot of that social communication was described in behaviors that are not being observed, right? Or abnormal behaviors that are being observed. So behavior is communication. And so what else does that mean other than the social part? Well, there's Teach is an autism program that some of you may have not heard of. It's from the same University of North Carolina, Chapel Hill, that does all that research and publishes that report that I was just talking to you about, and also creates those modules that I was referring to at the beginning. And it's an agency that's been around for a couple decades now, and they are one of the top experts in working with individuals with autism, and specifically young children. So one of their programs is called Teach, and this slide comes from one of their presentations, where when you see a child's behavior, and this could be for most kids, for all kids, for all people in general, but for kids with autism, when you see their behavior, whether that's desirable behavior or undesirable behavior, okay, this is both ways. So the ones we do want them to the ones we do want to see, and then also the ones we don't want to see or experience. It's representing how well their social communication skills are. For students with autism, because restricted and repetitive behaviors is one of the criteria, it's going to represent how well their flexibility in being able to transition from one activity to another or one interest to another. Their executive functioning skills, which I know in preschool all the kids are working on executive functioning because they're just too young to have developed them yet. But that's why there are common behaviors among all children in preschool. Again, desirable and undesirable. Sensory processing. If you have not seen this session, please view that session. That'll explain a lot behind the cause of some behavior when it comes to sensory processing. Auditory processing. That's everything that that all the information that's coming into through speech, whether they're able to process that well or not. Implicit learning, so their ability to be able to learn from others. And implicit learning, as many of you know, starts when they're babies. So with individuals with autism, they miss that part. The way their brain is developed, it doesn't allow them to be able to observe and learn from others when they're very, very young. So some of the lessons that neurotypical or kids with typical developing brains, or what we consider typical developing brains, the standard, some of the lessons they learn just from their being in their families and, when they're 2, 3 years old, kids with autism don't learn. So if they've had early intervention, they've been able to learn those lessons, then their behavior will show. But if they have not, and so they don't have those social behaviors, then that will also affect their behavior. Sticky attention is something that we talked about last summer, I think. And that's just, again, that has to do with that inability to transition from one thing of interest to another thing of interest. It's really hard. It's literally sticky. It's hard for them to detach from one thing to another. And then, so if they have coping skills when it comes to that, then you're going to see desirable behavior. If they don't, then that's when you're going to see undesirable behavior and multiple perspectives. And I think that's another one that, kids in preschool may struggle with in general, but some have this more developed than other, just understanding what it's like to be in other person's shoes, right? Other perspectives. So all of these skills, if they're not developed in a way that's standard to their typical peers, and they don't understand what's going on, or they're not able to communicate, or that they don't understand because they just have never had to do that, they haven't learned the skills to do that, then this is going to cause a lot of anxiety. And so their anxiety, as you can see at the bottom, rises from being out of balance in these type of skill levels. So that term splintered skills, right? They may be high in some, but they may be low in others. And so their ability is going to directly affect their way to communicate. So what may this look like? Okay, I think some of you already have an idea from what I've just described, but here are some more specific examples. This may look like them struggling. The key is struggling, right? They're really trying. They're trying to be successful in the environment. They want to be at school. They want to have friends. They want to be with the other kids. But if there are certain skill categories that they're really struggling with, then this is how it may manifest. That it may struggle to attend to their environment, very distractible. Imitate the actions of peers or adults, especially in preschool where you're going through a book and all the kids say the same thing, or you're going over the ABCs, or any of those skills that and strategies that you use, and they're not able to imitate at all, or have very poor skills. Comprehend verbal directions and info. So there we go. There's that auditory processing, right? It's very low. It's really hard for them to understand what you're saying and what they're supposed to do. Communicate their knowledge verbally. So there you go. If it's a child that has verbal skills, their speaking skills, and they're functional, they're usually able to talk and express themselves effectively, then if they're not able to do that, then that behavior right there is going to tell you that something is out of balance. Now, if they use alternative communication or are non-speaking, then we're going to talk about more of that in a little bit. Generalized information outside their routines. So they're very, very stuck to routines. There's that sticky attention, that repetitive behavior, right? It's really hard. Transitions are very hard. And there you go, adapt to change. So adapt to change usually means to new things. They don't want to try anything new because it took them so long to know how to be successful in what they just learned. And now if something changes, they have to learn all over again. And that was really hard for them. So think of behavior in those terms, okay? Especially when it comes to kids that either have already been diagnosed with autism or may have some of those characteristics. And with that, we're going to really lead into the communications and behavior and give you some strategies that you can use. What we're going to talk about right now, is nicely described and summarized in this article from Vanderbilt University. They have a whole school of evidence-based instructional evidence-based instructional practices for young children with autism and other disabilities. So again, this link right here, I invite you to click on when you see your PDF, and so that you can access it. So some of the information that we're going to go over right now is in this article. Okay, one thing that they focus on is on the ABCs of behavior, and this is a way of thinking about behavior. Okay, and when I'm talking about behavior, again, it could be the undesirable or desirable, but usually we're pretty accepting of the behavior we want to see, that we do expect, right? It's what we get really concerned when we experience the undesirable behavior, and we want to help the child understand why the desirable behavior is better than the undesirable behavior. Okay. All right. So what you're going to see in this article is called the ABCs of behavior. And A stands for antecedent, as you can see from the screen. B, behavior. C, consequence. Nice that it kind of works out that way. Antecedent, for those of you who have not heard that term before, is anything that happens before. So before the target time that you're looking at, which in this case is the behavior and usually the undesirable behavior. Okay. So anything that happens before is called the antecedent behavior, the antecedent trigger, the antecedent event. You may see antecedent attached to different terms, used as an adjective, I guess you could say. But again, it's just describing anything before the behavior. And then I think consequence is a pretty general term that we all know, but the one thing that people may not realize when it comes to consequence in this context is that it's anything that happens right after. I mean, I'm talking about right after the behavior occurs. Like, it may be even a look. The fact that everybody looked at the child, that is the immediate consequence of the behavior. Okay. So again, I'm just kind of helping you fine tune your ability to use the ABCs of behavior to your benefit, and obviously to the child's benefit too. So the question is, as you can see at the bottom of the screen, which of these can we control, and which ones should we focus on? All right. So in the live session, we had mixed answers to this question. So I'm not going to tell you right now. I'm going to show you an example. Okay. When it comes to the interfering behavior or undesirable behavior, as I've been describing it, we need to ask ourselves, what happens right before the behavior and what happens right after the behavior? Okay. So I did expand on that, and we're going to use the ABC. So here's the example I was thinking of, and then I think you'll have a better idea of what the correct answers to those questions are. Okay, ABCs of behavior. Here's the first example, right? A, antecedent. Billy sees a toy he wants. B, this just describes the behavior. That doesn't say if it's good or bad or hurtful or great or anything. It's just the behavior. Billy screams. Okay. C, remember what happens right after Billy screams. Billy's teacher gives him the toy. All right. So as you look at this example, you may think, well, the only thing we can really control is C. Okay, let's look at the next one. Susie is sitting on the carpet. Okay, Susie pinches the girl next to her. Susie is told to come sit by the teacher. All right, so again, this one, right? You may think, okay, well, C is the only thing because it's the teacher's reaction, right, that we have control over, right? Okay. Alex is given a math worksheet. So this is for an older child. Alex flips their desk. Alex gets sent to the principal's office. Again, we think, oh, well, consequence is the only action. Is it really though? Okay, so this happens once, right? We see that this occurs and we think, okay, remember, we're thinking through the lens as behavior is communication. All right. So Billy, these situations happen again. Billy sees a toy he wants. What did he learn this first time? He learned that to get that toy, he needs to scream, right? So again, we could change the consequence by the teacher, which probably does happen, right? Ignoring him, asking him to calm down so she can, we know there's a lot of consequences. But there's also, we have to start thinking in a way that we can also control what happens right before. And this is where the information in this presentation is going to come in. Because if we can provide Billy, Susie, and Alex with ways to communicate more, as they may be called, functionally or more desirably, other than screaming to tell people that he wants the toy, Susie pinching a girl to be able to come sit by the teacher, because that is probably why she pinched her, right? And Alex flipping the desk to get out of doing the math worksheet and be sent to the principal's office where maybe he gets help with the math worksheet, okay? So if we can provide and change what happens, right, their tools, their coping skills, their toolbox, their communication skills in A, then we can prevent B, right? We can prevent the undesirable behavior in B, because we're going to provide them with a more desirable way or functional way to communicate. And so C can still, C for the first one, Billy's teacher will give him the toy when he asks. Okay, so hopefully that helps, okay, to understand where the ABCs. Sometimes it's not as obvious though, okay? Sometimes, if the Susie sitting on the carpet pinches the girl next to her, if there's no relationship between that and it changes every time, then there's also a way to figure that out too. So let's continue going. Another piece of foundational knowledge, again, that I could talk a lot about, but I'm only going to put this out there to help you with the ABCs, is that there are the functions of behavior come down to 4 different categories. Could be sensory, so self-regulation, which again, if you haven't seen that session or if you don't know much about, please go watch that, because then you can learn. But it's really, if a child is overwhelmed by the environment, lights are too bright, could be just hunger or sickness too. It's something that we all, experience. Another child's touching them and they're very sensitive. So that would be the sensory category. Okay. Could be escape. Okay. Like that child flipping the desk could be the child trying to get out of a situation. And that situation could be they didn't like math. It could be that something in the environment is affecting them. So that's escape. Attention, right? I do this too. That usually is the first one we go to. And in that example, Susie, we could probably say that was attention, right? She wanted the teacher's attention, and she knew if she pinched, because she's probably done it before, that the teacher's going to have her come sit next to her so she could watch her. that's what the teacher's doing, but Susie's pretty happy to just sit next to the teacher because that's what she wanted. And tangibles, to get something, like the boy with the toy, right? So this is these are the 4 categories of a behavior, like the function of what the behavior is trying to get for the child or for the person. This could be applied to anybody. So here, think about some of the behaviors you see on a regular basis and what function are they serving? And so the key thing that we're going to focus on in this presentation is, how do we teach children how to communicate their needs and wants, right? When they have needs in any of these categories, how do we teach them, and what do we teach them to say or do to get their need met? Because these are all needs, okay? Whether we want them to be needs or not, that's a whole nother story, okay? The fact is that these are needs that the kids have at that moment. And so we want to teach them a functional way of them being able to express themselves in a way that's not hurting other people or throwing things or screaming, right? And then we need to then respect the fact that they communicate it in the way that we're asking them to, and then reinforce that. And so, okay, so we'll talk more about that in a little bit, but I'm just kind of planting the seeds there. All right, but there are those behaviors where we have no idea. We have no idea. And maybe it's multiple ones. Like I said, like, what if Susie does that and she still pinches the teacher? So obviously that wasn't it, right? So when that happens, we, and you're going to see this in the article of Vanderbilt, they suggest collecting data using an ABC form. Now, some of you may have learned this form before, but this is basically how you can become a detective. This helps you become a successful detective in trying to figure out the function of a child's behavior when it doesn't seem that you can't figure it out. And it could be for different reasons. Maybe that pinching is very effective and the child just keeps pinching until they get what they need, because they know that the adults are going to try everything to help the child stop pinching. But the idea is that, and this is the screenshot of the ABC form that article, the Vanderbilt article, includes, which is specifically for the students in preschool. And it's great. When I've worked with classrooms that use ABC forms, this is definitely what the staff usually prefers, because you're just checking boxes, right? And if you need to write something, you can just write it very quickly. You don't have to write everything out. So you take this for a few days or a week, usually a few days. After a while, especially if everybody in the classroom is doing it at different times, you'll start to see the pattern, and it'll help you identify what the function of the behavior is. And then once you know the function, then you can figure out what you need to teach a child, how you want the child to communicate that same function, with the need for that function, and then be able to teach them. And it's usually, you're just basically looking at what the other students in the class, how they're communicating the same thing, but in a more desirable way. And again, remember, students with autism and autism-like qualities, they don't always have, they don't have the ability when they're younger to just observe other kids communicating a certain way and imitate them, or model, and imitate them. So this is something that needs to be directly taught. All right, which comes down to functional communication training, which is that robust, that big evidence-based practice I talked to you about. So again, this is a very, very, very brief explanation of it, but it hopefully will help you understand the value and the importance of looking at looking at behavior as communication, and then it'll make more sense that some of the strategies that we talk about in a little bit. Okay, so when it comes to teaching, what we were just talking about, you have that first behavior, the antecedent, the A, or you may hear it called trigger. Then you have the problem behavior, or as you've heard it now called interfering behavior, and I've been calling it undesirable behavior. Okay. And so then you have to decide, okay, what's the replacement behavior? What do you want the child to do, right? And again, in this context of this presentation, I'm really encourage you to think, what type of desirable communication behavior you want them to use in order to meet that same need, right? That they have, the SEAT, as you saw the acronym, the sensory, escape, attention, or tangible. And then so that they can get to that same consequence that meets their need, right? That they're the reason why they're doing it, that you've been able to see through the pattern of collecting that ABC data. And then be able to reinforce that by, not only providing them with that desirable consequence, but, any other for students with autism really helps them to, really identify what they did correctly and how, that's going to help them be more successful in class. So we'll talk a little bit more about that. So typically communicated via problem behavior. Hi, notice me. I need help. I don't want that. What is that? I want one. Something's wrong. Okay. So there's some of those messages that typical kids may use it for the same that's their behaviors by saying these words, and that meets their need of that function. And unfortunately for the kid who has undesirable behavior, that may look like screaming, pinching, flipping desks. Okay, so we're just saying, like, for typical, it's saying those words, right, or being able to communicate those words. Okay, so here comes the more technical part of the functional communication training, evidence-based practice. But I think I'm hoping at this point, though, that you understand how it works based off of the foundation that we just established. So the interfering behavior, right? So take away the ABC part, because this is not set up like ABC, the antecedent behavior consequence. This is just a chart showing interfering behavior is the aggression, the property damage, elopement. The function then what would be that they figured out through the ABC data forms was to escape task demands. So every time that those interfering behaviors occurred, they figured out was to escape the task demands. So a desirable, functional, socially appropriate way to communicate instead of causing property damage or behaving in an aggressive way or elopement or running away is to ask for a break. Okay? Ask for a break so that they can possibly calm down, because obviously their anxiety level is so high that they're in fight and flight mode, right? The flight, get away, escape. So they're doing everything that they can do, the child or the person the data was taken on, was trying everything they could to escape the situation. Their anxiety was so high that their fight and flight mode was triggered. And so a replacement communicative behavior can be to ask for a break. That could be verbally to ask for a break if they are calm enough to do that. If they can identify themselves getting anxious and they're like, okay, I need a break to calm down, or I'm feeling anxious. And you may have heard some kids, talk this way, and it's probably because they had some early intervention around this before, or maybe you're working on these type of skills in your classroom. It also could look at like a break card, right, where you provide them with a couple different options, and they choose the break card to meet their need. And usually this is just the break card may not get them out of the activity or whatever is going on, but it'll give them a chance to calm down, to de-escalate, or get out of that anxious, that fight and flight mode long enough for them to be able to share with you what their needs are, and or for you to help through observing them, trial and error, asking them with a more collaborative way of working through the situation to figure out how you can, what's going on, what splintered skills are there, right? What skills they do not have that is causing them to feel so much anxiety that they want to escape by, and the way that they've escaped before somebody looked at this was through aggression, property damage, elopement, and it was pretty successful. It enabled them to escape immediately. So we'll talk more about teaching this, but as you can see, there's a lot of little steps to this. And here you go. I think the bottom example will be more, follows the same line of thinking. If it's aggression is screaming, is getting the obtained preferred item, like we saw in that example, then, obviously requesting an item and activity using words or some type of way of a more desirable way of communication or socially appropriate way of communication needs to be taught. That would be the replacement communicative behavior. Okay, so again, remember functional communication training. You'll probably want to learn more about this if you think that this is what you need in your classroom. It's a very effective strategy, but there are a lot of, just like you saw, foundational knowledge, moving pieces, just different parts to understand, and it makes sense. It's not. It's not hard to understand. It's just to understand it all so that you can implement it with fidelity, or to do it in the way that's going to be the most effective way possible so that everyone's successful. You're successful, the student's successful, everyone who's involved is successful. All right, so one last thing just to kind of flip that chart. So replacement behaviors would be saying help instead of screaming when the iPad turns off. Okay, so maybe we know the students who cannot use the iPad, but we've all been there when the tablet turns off because, it timed out, the charger, it's the charge, it's on 0%. And so instead of screaming at the top of their lungs, they can say help to get somebody to come help them. But again, remember, with all of these teaching them, just with everything else, if they are using what you want them, what the socially appropriate way of communicating is, then it needs to be respected and it needs to be reinforced by meeting that need. Handing a picture card to a peer to request a toy instead of grabbing it out of their hands. Okay, so you can see where all this can be applied in so many different situations. And again, I invite you to learn more about it. Okay, so the key thing for functional communication and just using this strategy for the replacement behaviors is that the only way that this is going to work, the replacement behaviors, the child is going to learn the replacement behaviors successfully, is if the replacement behaviors are easier and faster to use to get their need met than to interfering behaviors and the undesirable behavior. So let me go back really quick. So by being aggressive, hitting someone gets them removed from an environment immediately, then they're going to keep doing that to escape environments. Okay. Now, I know you need to keep other kids safe, including the child themselves. So it could be using just blocking, using your body to block, but then immediately having that break card or prompting the student to say break when it's occurring. Okay. And all of these, and then that would be faster, right? Because you're not giving into the escape. This child's not being removed from the situation. But when the student says break, you're like, oh, you want a break? Okay, let's go take a break. And then you remove them from the situation. All this needs to be taught to the child, though, when they're calm. And the child, they want to be successful. They don't want to be known as the child that always misbehaves. Maybe you don't want that to become part of their identity. And for some kids, it may be already. So, teaching them how to be successful in the classroom, to improve their self-confidence, and, will just kind of have a domino effect where they'll have more confidence to try other things and learn other things that will be more socially appropriate and help them feel successful and keep them in the classroom and around their friends. So, but how? What are some of the tools that you can use, right? Okay, well, this is where we're going to learn about another evidence-based practice, and that is AAC. And AAC requires a communication partner because communication is a two-way street, right? I talked a little bit earlier when I was going over the autism characteristics where, the anxiety, and I described it in a way that, or I generalize it so that, in the sense that I think this may happen to many of us, that when we're anxious or we're not feeling well, a lot of times that affects not only our ability to find words, but it also can affect our ability to understand words. Okay. And so it is a two-way street, and an evidence-based practice that helps with that is AAC. What is AAC though? Again, I'm going to describe this in a nutshell. But I think that once you start seeing the examples, you'll know that you are already practicing AAC. You may just need to fine tune your skills a little bit. Okay, so what is AAC, which is an acronym for Augmentative Alternative Communication, which if you look at those three words, those are all huge umbrellas. Those all each have their own big umbrella to themselves. And then put them together, that can mean a lot of different things. Now, I'm just showing this slide very quickly because the experts behind AAC and communication in general are SLPs, speech and language pathologists. And my background is not as a speech and language pathologist. My background is as a special education teacher. But as you have hopefully already read on this slide, I have lived with AAC in my life for over 18 years, both professionally and personally at the same time. So my father had a massive stroke and lived, as you saw, 13 years with severe apraxia and aphasia, along with paralysis on his right side. So he could not, for those of you not familiar with those terms, he could not speak. And due to the apraxia, he was not always able to choose what he wanted. Like, he couldn't point to what he wanted. He couldn't write. He couldn't, at the beginning, he couldn't even use a communication board to pick the right thing. So we used a lot of different forms of AAC to help him be able to express his needs, his wants, ideas, eventually opinions, desires, all that kind of stuff. And then at the same time, I was a special education teacher, MST, and I had, as you can see from the from the pictures on the left, as you can see from the pictures on the left side, I had children with autism, a lot of children with autism. I had children with cerebral palsy that lost their ability to speak. So I had a lot of kids that had very challenging communication needs. And then I went on to work for assistive technology, and specifically that focuses on AAC, a company called Mayer Johnson Toby Dynavox, for 8 years as an educational specialist. So I met a lot of people just like yourselves who work with children and adults, individuals, both in and out of school, in the home, and made friends with many adults, as you can see at the bottom. That's at the very, very bottom, and talked about AAC and different ways of using it. And so I feel like when I am talking about this, it's very, very personal to me, and I have seen a lot of success with it when it's implemented. And again, remember, you're going to see you are implementing some of it, so this is not going to be completely new. Just like thinking as behavior as communication, it's just a different way of it's a new way. It may be a new way of looking at it. It frames it in a way that helps you helps guide you in understanding how to use different communication tools to assist your students in learning how to communicate to get their needs and wants and desires and opinions met. All right, so according to NCAEP, so when you look up AAC, the evidence-based practice of AAC in those modules, and even in the report itself, you're going to see that AAC is described as unaided communication systems. So sign language and gestures fall underneath this category. Again, they have to be gestures that are functional communication. Like I mentioned, pointing to things that you want, pointing to the choice that you want, and meaning it, right? It'll meet the need or want or whatever it is that's going on, the function of the communication intent. Aided communication systems, such as exchanging pictures, pointing to letters, to spell out a word. This also covers what they call speech generation devices, or you may have seen iPads or tablets with software that can speak for the student. Okay. It also includes the methods of teaching AAC. So, great to have all these tools, but if you don't know how to teach this child how to use it and everybody around them, because communication is a two-way street between everybody around them, then it really won't help, right? So AAC also includes the methods of teaching, which we'll talk about a little bit about aided language modeling in this presentation. And of course, you're also going to need the teaching strategies of prompting, reinforcement, visual supports, and peer-mediated interventions, which were some of the ones that I identified at the very beginning. So if you would like to learn more about any of those, again, those modules will help you. Okay. All that said, remember that the experts on your site, at your educational setting, are the speech and language pathologists. They're also called speech teachers, or you may just hear them referred to as SLPs. Okay. Now, speech and language pathologists, the reason why I write out that whole word is because that is their job, is to support students. Their training is to help students and individuals, if they work with adults, with language and speech disorders. Expressive language disorder, which covers having problems sharing thoughts, ideas, and feelings. And receptive, right? Hearing, understanding, having trouble understanding what others say. So that's a key thing to remember about a speech and language pathologist. They not only help students learn how to talk and express themselves, both verbally, written, and if they're using an alternative way like the picture words or gestures in that way too, but also making sure if they have any receptive, if they don't understand what others are saying, helping them, learn coping skills and skills of how to do that, and probably communication of how to let people know that they don't understand what's going on. Remember, behavior is communication. So with speech, that's what a lot of people think of SLPs, helping students with articulation, voice, regulation, and fluency, right? The rhythm of speech, like, for example, stuttering. And also reading may fall under that as well. The one that we want to focus on today is the language part. So speech may go into it, but that may take time, right? And so you can work on speech and language at the same time. And so the AAC that we're talking about today is with the language. So what words mean, that words have multiple meanings, how to make new words, how to put words together, and what we should say at different times. There's that social communication, right? So while they're working on the speech part, they're also needing to work on the language part to be successful. Otherwise, you may get some undesirable behaviors if they don't feel that they are successful using speech, whether it means speaking or it means using their device or gesturing or whatever case may be. ASHA, which is the Professional Organization for Speech, Language, and Audiology, defines AAC as specifically as techniques and tools including picture communication boards, line drawings, the speech generation devices like I was talking about, with the iPad or the tablets with the software on it, or could be even more technical than that. Tangible objects, so handing objects to someone or choosing from objects, manual signs, so that sign language, gestures, and even finger spelling, which is, not specifically ASL, but it's along the same lines as ASL, or even a finger board, a ABC board, right, spelling things out. And it's the whole goal of AAC is to help the individual express thoughts, wants and needs, feelings, and ideas. Okay. I think we get really attached to making sure, and rightfully so, right? We just talked about behavior is communication, and there's functions of behavior, and the students are going to get their needs met, and the teaching communication needs to be faster than that undesirable behavior. The replacement communication behavior needs to be faster and more successful than the hitting, escape, running, all those other behaviors that we talked about. So wants and needs are important. Feelings, of course, are important for students with autism. That may be a little bit challenging. But again, you're in preschool, so some kids are a lot better at identifying that than others. They're in a good company. But then it's also helping them express their thoughts and ideas as well. Okay, not just assuming that they think something or they don't have ideas on their own. Just like other kids are able to express themselves, we also need to make sure that the kids that don't have the functional speech like the others do have a way of expressing themselves. Okay, that said, why would verbal kids, right? So I've been kind of clumping them all together with kids that are nonverbal or non-speaking. Why would they need AAC? Well, I think at this point, hopefully some of you get the idea that it's not just, for kids that are non-speaking or nonverbal, that it could be used to help kids understand as well, help kids who have high anxiety find another way to communicate their needs so that they can help, calm down. But let's listen to an adult. She's a self-advocate who spoke at a conference, and she talks about how she uses AAC. Now, this is in front of hundreds of people, so she's obviously very, in some points, very comfortable talking to people. But let's listen to what she says when she's in situations where she's not.
Communication supports. So Chloe has drastically changed my thinking on this. When Kelly and I first met.
Oh, and really quick, the adult that she's with is her occupational therapist that works with her because she has a lot of sensory needs. So she's going to talk to you about that.
Kelly had really not worked with anyone with a communication device at all. What? Not at the point that we met. No, not at the point that we met. Yeah. Now, a lot of my clients use communication systems, even if they can talk to communicate. This is where Chloe has expanded my thinking. Just because someone can talk to communicate does not mean that communication is easy all the time, right? And a device is not going to stop your student or child or loved one from learning and keep working on that skill, because it takes so much work to work a communication device. And if they can just say it, they will. I once had a teacher tell me to just tell me or go to the cafeteria. Well, that ended in a meltdown because I couldn't just tell her. And if I could, I would have. So there's high-tech ways of using communication systems. This is Chloe. Let's plug it. Chloe has a device. I use Proloco to go on her iPad, and this is her using it in the restaurant just at lunchtime. Sorry. You have your headphones on? Yeah. Okay, good. Okay, so it's really hard to hear because... But you got the point. It was very loud in the restaurant, and even with the headphones. And Chloe was growing overwhelmed, and so she used her communication device to say, I need my headphones, it's too loud in here. And I even put them on first, which is progress. Yeah, it was amazing. Yeah, so using that when the words won't come is very, very helpful. Another high-tech way of communication... and emailing. I won't even text him. I'm like, and we presented in Wyoming together, and we had rooms right next to each other. We still texted each other. Yes, instead of verbal communication. Instead of, heaven forbid, we get up off the chair and walk next door. Yeah. So the texting, why is that easier for you? Because it's like short, and you don't have to like have a whole conversation about something. It's easy. It's to the point. And it's always there, which is sometimes a good thing, sometimes a bad thing.
Sure. There's lots of low-tech communication support.
This was something I created for the airport.
So it says, hi, my name is Chloe. I have autism. I don't really like to be touched lightly. I love to travel. Please ask my mom or I if I have any questions. So in case...
If you have any questions.
If you have any questions.
I have it on a lanyard.
The words don't come out, she has that visual there to help her communicate
if they go to do a pat down and I start screaming, at least they're not as clueless.
Right, you have that there to
Although one time it happened and they made my mom even take my hand out of my mouth.
Because
they're TSA.
Right.
And that's protocol.
They are stricklers on protocol.
It was protocol.
Another low tech.
This was used for camp on the lanyard. I had a Chewy, I think I had a fidget, I had all of these communication cards, and a laminated little camp schedule for each day. And I wore this thing everywhere. When I went to bed in my little bed tent at night in the bunk bed, this was right there. We knew right where this was.
In case you can't see it, it says like, I am hungry, I want
squeezes.
I want squeezes.
I need a break, I need help, I'm thirsty, I want a drink.
So lots of,
I want to go for a walk.
Help communicating.
Even though I had my device, we were getting 2 opportunities.
Okay, so hopefully that kind of brought together a couple of things that we've been talking about, and showing how she uses it and why she uses it, right? It's all in situations where she's found that she's not very successful in communicating, and because of high anxiety, new situations. And so all those type of strategies help her help be successful. Vanderbilt has, in addition to what I shared with you before, Vanderbilt also has a whole article on, and I'm going to just call it online article. It's probably multiple pages if it was a paper article, but it just goes on and on and on AAC. And so some of the information that you're going to see moving forward is from that website, because it, like I said, it does focus on young children with autism and other disabilities. So according to Vanderbilt University, AAC is augmentative when used to supplement existing speech. Okay, so it's saying a child, has speech, but they need AAC when it helps them be more successful in speaking again, their needs, their wants, their ideas, their thoughts, their feelings. And alternative when used in place of speech that is absent or not functional. In short, AAC can support both expressive and receptive language and communication. So hopefully this definition now makes a lot more sense to you, since we've kind of broken it down and looked at different parts of it. So let's look at the augmentative aspect. And again, you probably will see some tools that you already use, so great. Give yourself a pat on the back, but think about kids that could probably use something like this, or maybe you're seeing a tool that you do use, presented in a different way. Okay, so what may augmentative look like? It may look like visual schedules. Okay, and so here's some pictures. There's the object schedule, is the one on the right. Okay. And then on the left, there's a combination of pictures and objects. And then first then charts. I think many of you probably use that. And if you don't, please definitely take a look at that Vanderbilt article, and they'll break it down for you. Okay, graphic organizers for story grammar also fall under augmentative. So some preschool options again, that's usually when you're reading those stories, right, to help the kids understand ideas, to really start establishing all those different literary elements of a story. And so here are some examples of that. And to see more ideas, you can go to this link down here. Okay. Alternative now is going to look like some of the things that we have already mentioned. So on that Vanderbilt article, you're going to see that they break it into low and light tech, which again may be pictures, objects, photographs. We have forgotten to mention photographs right now, but that's a big one, because some kids are not ready for symbols, right? But they're not they don't really need objects anymore. So, but having photographs of themselves or people they know is really powerful, especially with kids with autism, because the more meaningful it is to them, the more motivated they are to use it. I mean, other kids, of course, everybody likes to see pictures of themselves, but they're usually okay with cartoons or things that, that they still understand. But for kids with autism, if they're not getting it, bring themselves, their families, their favorite interest into it, and that'll make a huge difference. Writing, that's something we haven't seen yet, but I did mention that with SLPs, right? So this is also aided writing if students are not able to write. So maybe in preschool, you're not too worried about that in the sense of, but maybe for the letters, right? Sometimes individuals with autism have a hard time being able to hold pencils or hold crayons. So having an alternative way, and that's usually an OT challenge. So you may want to look at that. This is where OTs and SLPs work together, and communication boards and books. So anything with low tech. High tech, those speech generating devices like you saw Chloe using, recordable devices where they just say one message or a phrase. And again, talk to your SLP, see if some of these may be helpful for you in your classroom. In preschool, it's great because everybody's learning new vocabulary. Everybody's learning new ways of asking for things. Just the whole social communication. A lot of social communication is being taught. So you can use this for, all kids. So it could be normalized in your class. Low tech communication devices can look like PECs, which is what you see this little boy holding right here, which is that picture exchange that they were talking about. Here's a link to a video about it, so you can learn more about that. Again, talk to your SLP if you think this is something that any of the kids in your class may benefit from. Homemade binders or books of picture symbols. Okay, this is a lot of symbols on a page. Most of the time, kids do not learn these many symbols all at once. So again, I would look at the Vanderbilt, what they say about it, the strategies, and then talk to your SLP because they can guide you in how to use pictures. And it could be with all the kids. I really recommend in preschool to use make communication boards, like normalize them in the classroom, because this could be used for kids who become anxious easily, or have a hard time with change or new activities. Doesn't have to necessarily be autism. It could be used as a way to learn new vocabulary. So normalize the use of communication boards that have common phrases, like you see the puzzle communication board. This is like for a specific activity. Every time you do the activity, have that communication board out, teach all the students how to use it, model it yourself, and we're going to talk more about that. And so kids who need it can use it. Other kids can help kids who need it to use it as well. They can be your little teachers, your helpers. So it becomes normalized. And then when the students who need it use it, right? Remember, it needs to be quicker and faster than their undesirable behavior. When they use it, their communication intent, their use of that communication board will be respected by the other kids as well. So if you can, have some communication boards that are generalized in your classroom. Here's some of the mid-tech communication devices that they're saying, like to record certain phrases on there. This is great for any phrases that come up like in storybooks or that are usual responses to questions, for students who are learning that if they are verbal or speaking, or if they're nonverbal, then hitting that button that they know will say a certain phrase. And again, talk to your SLP about use of any of these mid-tech communication devices. And then high-tech communication, this is usually for students who don't have functional speech or are nonverbal, because they're going to be needing to use this, for a long period of time. And so again, talk to your SLP about that. So remember that AAC also includes the methods of teaching it. And so we did see this term aided language modeling. And so instead of me describing it, I'm going to let this video describe it a little, and I think it'll become clear. And then you have some other videos of how to teach the low-tech boards, the communication boards, and then overall AAC. And I think this will also drive in the idea why AAC and just communication is truly a two-way street. Not only is it talking about expressive and receptive, but also learning how to communicate takes everyone. It takes, everyone to help a child learn how to successfully communicate. So let's learn about this one specific strategy. Okay, so hopefully you got the idea from this video that when teaching any of these communication strategies, the adults and the communicators around them also need to use the same communication format to communicate. So if you are teaching students how to use a communication board, then you yourself also use the communication board. And you can still speak, right? But you're also pointing to the words that you're expecting them to point if they were to say the same exact message. Okay, so it may mean that you need to shorten your sentences to be more concise, and that's okay, right? Because you're really focusing in on what words are important. And again, you don't have to do this. I mean, the idea is to do it all day long, but you may want to start with just doing it during certain activities because it's new to you too. You're also learning, and tell the students, what it's like to be learning it. And as you saw as well, is that not only do the students need to see you and the other adults in the classroom, and then the other kids will also start doing it, but also it's going to take time. And, really think it's the same process as learning a second language. As when kids are very little learning how to speak, it took a long time for students to become fluent, right, with their communication. So the same thing may occur with the communication device. And the reason why I use the word may is because some kids do tend to catch on quicker, especially if they have stronger receptive skills, so they already know how to put sentences together. They understand that concept of putting phrases and sentences together. But if kids have not, don't have those strong receptive skills, in addition to not having the expressive skills, then they're going to take a little bit longer. But remember, just because a child doesn't know how to speak in the sense of using words verbally doesn't mean they're not understanding what's going on, like what the messages are, unless they're not following instructions, or they seem completely anxious and lost the whole time. Then obviously it is happening both ways. So that's why I highly recommend that you talk to your SLP. He or she will know what to do and can guide you through this process. Okay, so we're wrapping up. Again, remember a lot of those other evidence-based practices were mentioned: prompting, reinforcement, visual support, peer-mediated intervention, which is a big one in this one, as you probably have, you've heard me say many times. Before we wrap up, though, I want to just briefly go over some of the myths that we hear about teaching preschoolers AAC or using AAC. So just in case you've heard them or you hear them from other adults or parents, now, this is something that you can offer, the information you can offer to them. So myth 1 is introducing AAC will reduce an individual's motivation to improve on natural speech. So, obviously you hear this when children have speech or have had speech and now they've regressed, they've lost their speech, which happens with individuals with autism. And you just think of Chloe, okay? Think of Chloe and all the reasons why AAC enables her to have a more successful life, okay? But it says AAC should be introduced only after the ability to use natural speech has been completely ruled out. No, right? This is all to set them up for success. So especially in situations where if it's anxiety driven, why they can't use their expressive language, then that's where you just pull out those communication boards and just expect them to use the AAC, okay? Just expect them to use that communication board, so that expectation, and that can relieve some of their anxiety. So again, this is to help them be able to communicate in a functional way and not have to use undesirable behaviors to communicate and get their need met. Here's some research findings, okay, to reinforce that. And so you can share that with people. Myth 2, young children are not ready for AAC and will not require AAC until they reach school age. That's like saying children do not need to communicate until they reach school age, which we all know that's not true. So, so here's the research. And for those people who need research, there you go. You can provide them with the research. But again, that line of thinking is a little bit illogical when you think of AAC as the ability to be able to functionally and socially communicate for students who are either have deficits in social communication or are nonverbal. And then myth 3, prerequisite skills such as understanding of cause and effect and showing communicative intent, meaning wanting to communicate with somebody else, must be demonstrated before AAC should be considered. Individuals with cognitive deficits are not able to learn to use AAC, which I hear this one still, and that is not true, okay? They're going to communicate, okay? They are communicating through undesirable behaviors. Will they be able to use a Proloquo on an iPad, on a tablet with a large number of pictures? Probably not at first. They may be limited to a few of the most essential communication symbols or words, depending on which, pictures, whatever they use at the beginning. But that's okay. That's a form of communication. And once they learn that using that will get them their needs met and their wants and expressive ideas, then it will build. It may take more time, but communication does take more time, usually with individuals with cognitive deficits. I mean, I even saw that with my dad, okay? Because, a stroke can be similar to a traumatic brain injury. So, it is in a way kind of a traumatic brain injury. So, he was a very, very eloquent speaker. before the stroke. So it was very frustrating once he realized, but it took time because his brain needed, was slower at making the connection. So again, it's just going to take more time, but it's not impossible. All right. And we did not play this in our session because we ran out of time at that point. I will play it for us today because it's a recording. It's just a good summary of everything we just covered. The next slide, and again, you will see this in your PDF, is our email addresses. So I know we went over a lot of information today. And you can access the modules, but if there's something that you don't understand or you just feel a little lost or you feel anxious because you're a little overwhelmed, please reach out and let us know how we can help, because communication is so important. I know undesirable, interfering problem behaviors are very frustrating and distracting for everyone in the classroom. So keep in mind, behavior is communication, and you're working with preschoolers, so everybody's in a more similar boat than in other grades. And hopefully you saw some of this, at least one or two of the strategies today that you can teach your class to help everyone support each other in learning social communication. All right, let's watch this video and to sum up what we learned about today.
One mistake can get your resume
Communication is crucial to our everyday lives. We use it to share feelings, stories, ideas, to make friends, and to get our needs met. We began to communicate right from the moment we were born. Communication isn't just speech. We all use gestures, body language, visuals, and text to communicate every day. Communication is about understanding and being understood by others. Some people may need systems or devices to help them communicate. This is known as Augmentative and Alternative Communication, or AAC for short. AAC can be many different things and can do lots of different jobs for people. Sally might need an iPad to talk for her, while Bob needs some picture visuals to help him understand what he needs to do. It's a speech and language therapist's job to work with people to come up with the best AAC solution for their needs. Here are some of the ways AAC is useful. Spoken words are only temporary. AAC provides people with a concrete and permanent visual so they have longer to process information and formulate a response. AAC increases a person's ability to engage with their peers in social situations and to initiate conversations. AAC has been proven to support the natural development of speech and language. Communicating with someone in a way that they can understand opens a door to their beautiful mind. When a person first gets a new piece of AAC, it can seem a little strange and overwhelming. If their family and friends try to use the device as well, it can help it to seem less scary. When you're learning a new language, you need lots of repetitions. It's the same with AAC. People need lots of repetitions often to help them learn how to use it. AAC becomes a person's voice and therefore always needs to be accessible to them. Augmentative and alternative communication ensures that everyone has the opportunity to understand and to be understood, no matter what their challenges are. If you would like to know more about AAC, speak to your speech and language therapist and they will be able to help you out.
Okay, thank you so much for attending this session. We hope it was helpful, and this is part 1 of part 2. The next session is going to be about setting up a communication-friendly classroom, which I have a feeling at this point you know some of the ideas that we're going to expand upon. All right. Well, take care. Thank you for all you do for students, parents, and each other.